Hello, everyone. Welcome back to Invisible InCourage. Today we have an incredible guest, Dr. Peter Abaci, and he is a chronic pain doctor, and he has been just about everywhere. He is one of the pain experts for WebMD. He has a iHeartRadio talk show. He's written several books, and this year he was selected to be one of the speakers at South by Southwest. Welcome, Dr. Abaci.
Thank you. Thanks for having me.
So tell us a little bit how you got into pain management. And what is pain management?
Well, pain management for me really means working with people with very complicated, usually chronic pain problems whose lives are significantly impacted and disrupted, maybe in many different ways, and helping people in the situation have a great life with whatever the challenges may be. When I got into it, it really wasn't what I thought. It was a new specialty. I was doing my anesthesia training at USC at the time, and pain management was this whole new exciting thing. And, I was learning how to do some new procedures and nerve blocks and prescribe or use special medications that were all kind of new. And I could, make people just change the way they felt immediately by doing these things. And I thought I was really cool doing that. And I thought it was a really, interesting, exciting specialty to get into. But what I didn't realize until much later, until I started doing my fellowship at UCSF, was that's not pain management. And by making people's pain go away for a few hours, I wasn't changing people's lives or helping them, improve on all the different challenges that maybe they were dealing with. And I came to realize that working with people with chronic pain was really about diving much deeper and really leaning into a lot of challenging problems, mind, body, and soul. And so for me, that's what pain management really is. It took me a little time to learn that, but that's how I see it now.
So what sort of strategies are needed to encompass all of the mind, body, spirit aspects of chronic pain?
Well, of course, everybody needs a toolbox. You need your set of skills and tools that you can use and rely on. And to get that, it takes, I always say getting well is hard work. It's not easy. And it takes time to develop the right, whether it's exercises, stretches, meditation, hobbies, whatever it is that makes you feel better and puts your pain in a box so that you can live, the way that you like and enjoy your life. Those are all valuable tools. And how can you help somebody be empowered to get those tools? And a lot of times it takes time, it takes some faith and belief. And it's usually building a process to help a person work through that.
Right, because chronic pain just takes away so much of our entire lives. It's really hard to not let it just take over completely when it's so drastic and it's just there every second of our lives.
It really affects everything, your sleep, your attitude, your mood, your relationships, whether you can work or not, what kind of fun things you get to do. And so in order to help somebody who's in that situation, you have to focus or treat or address all those different areas of their lives. And that's what we try to do as best we can.
So tell us a little about your clinic and what team of practitioners you have there that's able to treat these different areas.
So we've kind of put together a true, what we call interdisciplinary center, meaning different specialties specialists who work together as a team in a sort of coordinated way. And believe it or not, we're mostly always on the same page. And so we've got, medical people like doctors and nurse practitioners. We've got physical therapists and exercise specialists, trainers. We've got psychologists, a whole behavioral health team, some therapists. We've got a great art therapy group. Art therapy is a great part of what we do. We have some great wellness instructors on the team who, specialize in yoga, tai chi, meditation work, things like that. We've had some acupuncturists that work with us. A whole lot of different people who want to work together as a team to help people, with these kind of challenging situations.
Yeah, that's incredible to not have to go to so many different areas. So if a patient comes in, what is it like? Do they see all of these people in one time? Is it a long-term center? Is it just one big check-in?
Well, so when you walk in the door, come off the elevator, it doesn't look like a traditional doctor's office
That makes
where
sense.
it's kind of stodgy looking. What you're going to see is open spaces, a gym, artwork, patient, artwork, people exercising, people dancing. We do a lot of dance work. You'll hear music. It'll be like going to a fun place in a way. And then we do have traditional exam rooms and things for your visit, your consultation with your doctor. But it's not like going through a traditional um, medical clinic. And at any one time, there's like many things going on. There might be people exercising and other people, dancing or doing other stuff. And we have some special comprehensive programs that we do, like day programs, which are small group settings where people go from class to class during the day. And it's an important part of what we do for a lot of our patients. So it's not boring, that's for sure. There's a lot going on.
Yeah, there's very few dancing in most of my neurology offices for sure.
Well, I am blessed to work with such great people, and they bring such great ideas and a great spirit to what we do. So I couldn't dance to save my life, but we have people who are have expertise in dance, and so they learn how to modify and create programs for people with disabilities with chronic pain. Some of it may be in a chair, so that you can still move and enjoy dancing and music. Same with the art therapy. We've been blessed to work with some great art therapists, including Christine Peter Abaci, who's been with us for a long time, and just do all these wonderful projects. And then you end up putting on art shows and things like that in the community, and it's powerful stuff.
That's incredible. It's so rare that, a doctor would even touch on, basic activities, what you're able to do during life, what you're able to enjoy, really just quality of life things. That's really cool. Tell us about your books. What did you write about in your books?
Well, my first book was I where I started with the book thing was I was just a traditional private practice doctor, just doing my thing, and I got really frustrated with healthcare and medicine and what was going on in the world, and I felt like patients were being set up to lose over and over and over again, and the traditional medical treatments that they were getting, it was just bogus to me, and it was just making people's lives worse, not better in many cases. And then they would come to me in my office, and I felt frustrated. And so at one point I said, I can sit here and complain about this every day, or maybe I can do something about it. And I thought, maybe if I write a book, people will read it and it'll change things. So I was very naive at that time. This is a little over 10 years ago now, and I didn't know anything about books or the book industry or how to get involved. And so it was a little bit of a process to learn that you have to get a book agent, and how do you get a book agent, and then they have to pitch you to a publisher if you want, and I was going the publishing route, and how to make that happen, and then how to get the work, how to actually write the book, because I'd never done that before. And it was quite a deal, but it was great. And so I got the first book out about 10 years ago, Take Charge of Your Chronic Pain. And it really I found that it really connected me with my patients in a deeper level, because they started reading all these things that I was writing, and they started to see themselves in the pages. A lot of the examples and things that I was writing about, they really connected with. And a lot of them started saying, I feel like this book is about me, even though it wasn't necessarily about them in particular, but it goes to speak to, when you have chronic pain, you feel so isolated and alone, and you feel like nobody understands or knows what it's like to be in your shoes. And then you start to realize at some point, when you connect with other people, there's a lot of people who are struggling with a lot of the same things that you may have. You just don't realize it. And so I think people get that out of the books. And so the second book that I did, which came out I think about 4 years ago, is called Conquer Your Chronic Pain. And I kind of built off of the first book, which is kind of a beginner's self-help guide, for what do you do when how do you live well with this problem? And I took it a little bit deeper. I got more into the science. I got more into some of the brain science and understanding the brain-body connection. I got more into some of the more deeper psychological issues like trauma and PTSD. And so that's kind of where I went with the second book.
Yeah. How do trauma and PTSD interact with chronic pain?
Well, we've learned that it can be a really big deal. And it seems some studies have found that about 50% of people who have chronic pain also have trauma-like symptoms.
Wow.
Yeah, very big. And if you don't think about it, if you don't look for it, if you don't test for it, you may not know that that's part of the patient's experience of what they're dealing with or struggling with. But many times it's hard to get well if you're feeling trauma symptoms that are not well managed or appropriately addressed. And so sometimes in order to help somebody get well with their pain problem or its back problem or whatever it is, you have to also help them get through their trauma symptoms and get that better managed. So it's really important. And in my second book, Conquer Your Chronic Pain, I talk about 3 kinds of trauma that interact with pain.
Exactly.
The first one is if you've had a traumatic experience earlier in life, and then later something new happens, maybe you have a new injury, a car accident, it may trigger, a reaction. That trauma memory is still in there, and you may start to feel those trauma symptoms again from the new injury, even though you may not even think about it or maybe even remember it. So that's one. The second type of trauma problem is the way the pain was started or the injury maybe that created it can be traumatic. You might fall off a building or be a bad accident. It can be a traumatic experience, and then you start having these trauma symptoms at the time that the injury starts, and they continue if they're not appropriately treated. And then the third kind is what I say, just being in pain for a long time itself can be traumatic.
Absolutely.
Living that life day in and day out starts to become its own source of trauma. And so it's very important to know how to recognize and help people with that as part of the bigger picture.
Definitely. I try to bring up very frequently that just going through the medical system and having to navigate all those challenges can be a big source of PTSD for many patients.
I totally get it.
So what are some routes that you would instruct a patient to take if they have to deal with one of these traumas?
Well, so at a basic level with trauma, you talk about the fight or flight response. And some interesting trauma people like Peter Levine talk about fight, flight, or freeze, where you're in such trauma that you can't do anything, as opposed to trying to fight or run away. And it means that you're so overwhelmed by the activity of your nervous system that you can't function. You can't work, you can't communicate, you can't relate to people, you can't relate to yourself. You're overwhelmed. And so how do you calm down the nervous system in such a way that you rise above that, and then you can start to engage with other treatments or other parts of your life? Many ways of doing that, like doing yoga, for some people works. Art therapy, which we use, can be very therapeutic for that. There's something called EMDR, which don't ask me to say out the long name, but we have a therapist who does the eye movement work with EMDR to help treat trauma. And we started a special comprehensive PTSD program last year in our practice, just not for pain, but just for PTSD, which has been really helpful for a lot of patients. There's a lot that can be done, but the first step is to recognize it's there and figure out what can be done about it.
Definitely. Just putting a name on a condition like that can be such a source of comfort and validation for patients.
And let's be honest, this whole COVID pandemic that we're in the middle of, I think it's traumatic for a lot of people, whether you're a first line worker, a first responder, or you're a patient, or a family member of a patient who's gone through this. It's going to be a big issue that as a country, as a world, that we're going to have to address more effectively.
Definitely. What are some other misconceptions along with the trauma piece that people have regarding chronic pain, people living with chronic pain?
Well, I think that I think, because you don't have like a test, I always tell patients, I treat patients, I don't treat MRIs. And there's not really like a lab test or an MRI or something that explains a person's pain.
Mhm.
So people often feel very misunderstood, and not understood about what they're going through. And I write about in Conquer Chronic Pain, and some of my core elements of a successful pain management program. One of the core elements is validation, and
Yeah.
everybody has to be validated for what they're dealing with, what their experience is. And if you see a doctor who you don't feel is taking you seriously, or your husband or wife isn't really taking you seriously, or whatever, if you don't feel like people really believe you,
So
even though they can't see the problem, maybe looking at you, then that's a problem. And we have to get past, we have to validate so that we can move forward. And I don't think people realize that or recognize that or talk about that.
yeah, there's such a struggle when your disability or your illness is invisible, and people can't believe you because if they look like that, that's not how they would feel. And it's very hard to imagine when there's no test, there's no outward symbol that you are sick or you are hurting.
Exactly. Kelly, I'm looking at you on the screen, and you've got a bright, shiny face and a great smile, and if you, I would never know your story, right? Your life story, what you've been through, and what the shoes you're walking in. And we had a chance to talk a little bit before we start, and it's all very real, and people have to accept all of you. To be a part of your life.
Absolutely. Yes, going through a terrible, terrible migraine attack right now, but fighting through.
I'm sorry. I'll try not to talk too loud.
Thank you. Thank you. Yeah. So, what are some other aspects of your treatment plans that you really focus on that a lot of other doctors may miss or not think about?
Well, so I'll say this. When you look at this, pain and disability and chronic disease, and people struggle with figuring out how to measure good outcomes. What makes a good outcome? How do you know you're doing right by your patients? How do the people that you're treating know that they're getting better? It's hard to measure, and you can't. I believe you can't really say that you base it on how little pain somebody has, and you just keep medicating and medicating until they don't feel anything. But what's their life like? Are they rolled up in a ball in a corner of their house and not really living? Then that, to me, that's not really success. And so I think, and I was asked this question once when I was working for a doing some education work for a foundation. How do you measure success?
Right.
And I really think the at a fundamental level,
Mhm.
it's how much extra activity you can help a person do. How you can help them get more whether it's steps on the Fitbit, or more mobile, or more upright during the day, or whatever you can do that helps a person move around and get around better.
Yeah.
Then you're doing something right. And I think that needs to be a significant thing that we can measure. The other important thing that I talk about that you can't measure, but I think is the most important thing, is love. And I think nothing takes that away more than a pain problem, a chronic pain problem of some kind, because your mood changes, your ability to communicate and interact with people gets affected. Maybe you don't go to work anymore. Your social isolation goes up. It's hard to get around and connect with people. And so when you take that away, what is there in life more valuable than that? And what's important about love is not just to be loved, but to be really fulfilled. We need to be able to express love for other people. It's a two-way thing. And so I would argue that whatever you're doing with your treatment, your medical care, with whatever problems or diseases you have, whatever chronic pain issues you have, if whatever you're doing is not improving or bringing more love into your life in a meaningful way, then it's not really working for you. And that's really, so it's, I think my one advice is to keep that in the back of your head for listeners, that that's the ultimate goal, and that's the real measure of what you want out of this whole deal.
Absolutely. So many people living with chronic illness or chronic pain, they go through a phase where, people at first, people are always there, they're always caring, and then compassion fatigue sort of sets in. And if you say every day, like, oh, I still feel really bad, you know, people tend to disappear after that point, and they tend to live a socially isolated life, and it's really challenging.
Very much so.
Well. So if someone is going through chronic pain or just pain in general, and they're not getting proper care, how would you, what tips do you have for them to find better care? What should they be looking for?
Well, that's, that's a great question, and it's a challenge for a lot of people. What's available to you really varies from community to community. One person might live in a community where there might be a lot of, great yoga classes or Tai Chi classes that might be something to tap into. Another person might live in a community where, maybe there's a great Pilates teacher. And, someone else, might be somewhere where, there might be a behavioral health person, like a psychologist who's an expert in pain management, that you'd want to connect with. Finding the real passionate healers in your community that, want to work with someone with a chronic disease. Like for example, you talked about people giving up. A lot of healthcare people are trained that way. We're trained to deal with acute injuries or acute diseases, sports injuries, things like that. And we're not really trained to hang in there and stay in there for a longer period of time. Definitely. You'll see that, some physical therapists don't know anything about chronic pain. It's not part of their training. They're trained to treat the acute injury and move on. So finding people who understand that takes, I think, some digging in your communities to find those kind of valuable resources. But my guess is, as we grow as a society and we understand some of these things better and better, there's going to be more and more of those. And then the other thing that we're finding is, with one of the positives of the pandemic, is a lot of people are looking for more online resources, telehealth resources. I just wrote an article for WebMD about that. So we were starting to see that maybe we can find help, in other ways. A great example is doing psychological counseling work, through telehealth, like with a counselor through the computer, can work really, really well, can be really effective. So there doesn't have to be somebody down the street that you have to get in the car to go see. There's someone who used to work in my practice who moved to Germany maybe about 4 or 5 years ago and started doing this telehealth counseling work for people in California from Germany. And I think it's been pretty successful for her and her patients. And so we're starting to get a little more creative in where we can find these resources.
Yeah, and that's so great. And the access is just really taking off. Of course, it doesn't account for all the financial aspects of people actually being able to afford it and everything. But just if you're in, a medical desert situation, like, you can actually get help now, which is really, really impressive.
And it's not free, I guess. But
yeah. We'll work on that eventually.
Work on that. Well, we definitely need better coverage by insurance companies, Medicare, for a lot of the things that we're talking about. Unfortunately, it's just not covered well, and that inhibits access, which is not good for anybody.
Right. Alternative strategies are just so difficult to get insured, and it's really difficult for all these patients who have to go through that.
Exactly.
What have you learned from your patients?
Well, I think that one of the most important things for my patients is to experience gratitude. And I think that I have some patients who they're very thankful for whatever opportunities we're able to get for them from a treatment standpoint. They get to participate in a big program or something like that. When they feel that gratitude and they express that and they say, I just want to thank you for this. I really appreciate it. It really means a lot. And it means a lot. It means a lot to me. But I also think that it makes them feel so much better on the inside. And I think when we're when we're grateful and feeling gratitude and connecting with that, I think our mood, our pain, our quality of life, so many things get elevated. And when I see patients embrace that, no matter how big the mountain is they're climbing, I think it takes them to a better place. And interestingly, I remember a presentation a number of years ago about gratitude, and they were doing a study, and they found that, and they were having people write down every day for like a month or something, things that they were grateful for, putting it in a box and keeping track. And what they found was people who are in chronic pain have a really hard time being grateful for anything and writing anything down that they're really grateful for. And so I think being able to connect with that in some way is a really important, one of the game changers in this process.
It's so cool. It's so cool to be able to see a doctor who is clearly so compassionate and really understands like the full body, treating the full patient. That's
very important.
We're very grateful to have you here, and we're very grateful that you are treating so many patients and changing so many lives.
Thanks for having me.
Of course. So the one question we always end on is dealing with chronic pain and invisible disabilities, and sometimes forever seems too much of an obstacle to complete. It seems too intimidating, and it just doesn't seem possible. So when you're living day to day, through your darkest days and your toughest hours, what gives you the courage just to get through one more day?
Well, so I've had my dark days, and I've been there, and I think one of my darkest, at least as far as pain and suffering goes, was when I had a really bad herniated extruded disc in my back, which landed on my one of my nerve roots and caused the most excruciating, debilitating, burning, on fire pain down my leg. And that went on for a while, and I couldn't sleep. I couldn't sit in a chair. I was so debilitated for a while, and I could, all night long I would just pace around the house, and then I would go to work, in the morning, and and I couldn't drive. My wife would drive me to work. I'd lay in the back of the car on my stomach, and then I'd go work all day, and then she'd come pick me up at the end of the day. And that went on for a while until eventually things improved. But that was a hard thing to get through. And some of the things that got me through that was definitely my faith. Yeah. I was raised, going to Sunday school. I went to an Armenian church growing up, and I still go to one now. And we say the Lord's Prayer, and so I would just say that over and over again when I was in my most severe states, until I felt like things would calm down, and it would get me through maybe one moment to the next, or 1 hour to the next. But after you get through it, though, then you start to realize that you say, hey, if I could get through that, I can do anything. And the next time something bad happens to me, the next time life doesn't treat me well, I'm ready, because I got through that, and I know I can do it again. And so I think in the long run, it gives you strength, even though it sucks when it's happening, right?
Yeah. Doesn't feel like it at the time, but surely it does.
Yeah.
Absolutely. Well, thank you so much. Do you have anything else, any messages to get out to the invisible disabilities community?
No, I think you guys are a great example to the country right now. A lot of people are struggling with a very stressful health crisis, the pandemic. And, you guys can be great motivators, great examples of how to deal with stress and trauma, and being resilient and being strong. And so I urge you guys to share some of your knowledge and love with everybody else, because I think people could really use it right now.
I definitely agree. All right. Well, thank you so much.